I'm here at the 2018 first annual Society for Opioid-Free Anesthesia Conference, and it's been amazing so far. Really learned a lot so far, and I really look forward to bringing you guys some videos just explaining some of what I've been learning, explaining the techniques, explaining how to go about starting this. If you want to start moving towards or getting completely to opioid-free anesthesia, I'm learning how to do it, and I'm going to bring it to you guys. I'm learning from the best, some incredible speakers. I'll give you guys a lineup later and tell you about each speaker and who they are and what they do. One of the speakers and you know, obviously the guy kind of organizing everything is Tom. Tom's the president of SOFA, and he's the one who put together this conference, and he's the one who really is making it happen and creating this movement and pushing it forward. And there's so many people here, so many CRNAs who just independent CRNAs, you know, working out on their own, and they're doing this. You know, they're doing it. They're leading the charge against the opioid crisis in our country, and it's amazing when you actually begin to learn some of the history. You begin to learn some of why do we do things the way we do it. You know, you're being taught how to do anesthesia a way that it's been done this way for like 50 years. And the question is, why have they been doing it that way for 50 years when really there isn't necessarily good evidence, or we've seen some of the hints of the problems with opioids way back then. You know, people way back then, one of the speakers, a guy from Bruges, across the ocean, he actually spoke about just the history of opium and the poppy and how it came to be used for medicine and everything. And even way back then, hundreds of years ago, they were already talking about the dangers of the poppy, the dangers of opioids. And it's pretty strikingly similar to what we're seeing right now and what we're saying right now. So it's very interesting stuff, very cutting edge stuff. And like I said, I'm here learning, and I'm gonna be bringing some of these videos to you guys. I want you guys to have some resources. Of course, Society for Opioid-Free Anesthesia, they're the resource right now. If you're not a member, join. You get access to their website and just a lot of information on their website to help you begin this process. Of course, also the Block Buddy app has a whole section on non-opioid anesthetics, which is really good as well. You know, for getting drug dosages and all that kind of stuff. But the question is, how do you begin to institute this? You know, if you haven't done this before, what do you do to start this process of becoming opioid free in your own practice? And that's what I want to bring to you. Those are the videos that I want to bring you. So for instance, so you find out, oh, opioid free anesthesia, you do a lidocaine drip. Okay, well, what are the little nuances of doing that? What are the things that happen, you know, when you start to do that? And what are the little things you need to learn that you can't necessarily read in a textbook? Or again, some of this is kind of novel. It's new stuff. It's not necessarily something you're going to find in a textbook. So how do you go about implementing this stuff? And if you're one of my students, we're going to start doing this stuff. I'm ready to start doing it. So we're going to start doing ketamine boluses, ketamine infusions. We're going to start doing lidocaine infusions and boluses. We're going to start giving like 0 opioids. That's my goal. That's what I want to do. Especially for at the very least, you know, got to get started, especially for the morbidly obese patient, especially for the drug addicted or previously drug addicted patient. These are the patients to begin to use this technique on, so that we can get people to a place where we're not using opioids. I forget what the statistic is, but even, you know, so you think, oh, it's, you know, it's just for those patients. It's just for the, you know, the obese or the drug addicted patient, or the patient on methadone or Suboxone or whatever, but it's not. Even opioid naive patients I forget exactly what the statistic is. I'll bring these things to bear in future videos when I'm talking about stuff, but I think it's something like 7% of opioid naive patients end up addicted to opioids after having anesthesia. Really, I should say after having surgery, not to blame anesthesia, but just in the fact that they have anesthesia, they go home with pain medicine, and they end up 3, 6, 9 months later still on pain medicine, and they end up drug addicted. So there's a lot that goes into something like that, neuroplasticity, tolerance, all kinds of different things, but it can happen. And so we need to really be on the front lines of preventing this and dealing with it. So, all right, that's all for now. It's early in the morning. We're getting ready to get started soon here. So I will catch you later.